Hello, moms. I, Leena Raut, welcome you all on GenX Parenting. May is Mother's Day, and on that occasion, we have a very special session which is talking about one of the most crucial aspects of motherhood, that is breastfeeding, especially for the new mommies who are about to embark on this journey. Breastfeeding is a human biological norm. It is natural, it is instinctual, and most importantly, it is an extremely satisfying experience for the mother and for the child. We all have heard about the significance of breastfeeding from the professionals and from the nannies and chachis and dadis of the world. But in this video, we are going to talk about something which is not much discussed with the new moms. So, watch this video till the end very patiently. We are going to cover, firstly, what is the preparation that a would-be mother should undergo during her pregnancy period so as to prepare herself for breastfeeding? What are the challenges of breastfeeding and how to approach them so that you are prepared better and do not get frustrated or panic if a situation happens with you? What are the breastfeeding techniques to ensure happy babies and healthy babies, and of course, relaxed mothers? And what are the tips to improve quantity and quality of the breast milk? To help us with the same, we have with us Dr. Mansi Jani. She is an international board certified lactation consultant and infant and child feeding counselor. She comes with an extensive experience of over a decade. She's associated with Apollo Hospitals, Navi Mumbai, and also has a roaring private practice. So, let us welcome our expert and get going with our discussion. Hello, Dr. Mansi. Welcome to GenX Parenting.
Hi, Leena. Thank you so much for having me with you here. I am thrilled to share my ideas and discuss with you further on the topic of breastfeeding and how we can make the breastfeeding and baby care easier for the new moms during their early stages of motherhood.
So, starting with our first question, that post birth of a baby, it's a very, very overwhelming situation for the mother. She is recovering herself, and baby demands breastfeeding. So, any piece of advice for such moms or for the would-be moms so that they can prepare themselves better during the pregnancy period itself and embark on this beautiful journey of breastfeeding in a smoother manner?
Postpartum in itself is a huge change for a new mother. Going from pregnancy to delivering a baby, handling the pain, discomforts of delivering a baby, even if it's a vaginal delivery or a cesarean section, sleepless nights, discomforts, lack of adequate food, fluid intake, and along with that, taking over a new activity, breastfeeding, handling a new baby can be overwhelming, especially in the early days. So, what I recommend to all the expectant parents, expecting couples out there, is you take a breastfeeding class in your antenatal period. That is when you have completed your 2 trimesters and you're entering towards your 3rd trimester, you have completed your 34 weeks of pregnancy. You get in touch with a lactation consultant, get in touch with a gynecologist, and take a breastfeeding class. How a breastfeeding class helps you is it gives you knowledge of what to expect going ahead when your baby arrives in terms of breastfeeding positions, how to latch your baby. You can get your breast examination done. Your breast examination will help you to understand what positions, what techniques would be comfortable for you and baby. Whether sleeping position would be comfortable in feeding, whether sitting position, what holds would be comfortable for you after your delivery. You can also, your lactation consultant can also help you guide if there are any breast or nipple related issues if present, like inverted nipples, flat nipples. So these issues can lead to further complications when your baby arrives. So beforehand, you can be aware, you can follow some exercises, you can take certain tips and make your journey easier after your baby arrives. One more important benefit of antenatal counseling, of getting a breastfeeding class in pregnancy, is you can learn how to express your milk after your before your delivery, so that you can use the milk after the delivery if just in case you and baby are not being able to establish breastfeeding just in the very few early hours after your birth. So how the antenatal milk expression works is you have to gently go with breast massaging, just massaging your breast gently. You can take a hot water shower, and after that you can go for your breast massaging. This you have to start after you've completed your 37 weeks of pregnancy, not in the early stages. After your breast massaging, you have to make a C shape of your hand. With a C shape, you have to hold your breast, keeping your fingers away from the areola, away from the dark area behind the nipple. You have to hold your breast in a C shape. You have to stretch your fingers behind and then give a press. So it's like you stretch and press, stretch and press. You will have to do a couple of times for a few drops of colostrum to release. The breast milk is already being prepared in your breast when you are 5th month pregnant. So removing the breast milk in your antenatal period and storing the breast milk can help you use that milk after the delivery of baby. You can store the breast milk in small syringes. You can refrigerate it for 24 to 48 hours, and you can use it afterwards, after you delivered a baby. So this tip your lactation consultant will guide you once you take a breastfeeding class. So also you can get guidance on how many times you're supposed to breastfeed your baby, how to understand what are baby's hunger signals, what are baby's signals when baby is satisfied, how to understand whether your milk is sufficient for baby, how many times baby is supposed to urinate or pass stools, how to burp your baby. So these things, getting knowledge of these things in your antenatal period would really empower you, would make you prepared of how you're going to deal with the new activity that you and baby are going to be exposed to just after delivery. So that is my recommendation towards taking a breastfeeding class in your antenatal period, preferably couple class, so that both of y'all are equipped and you can easily handle your baby once the baby are right.
Now, coming to our next question, what are the breastfeeding challenges that mothers should expect, and how do they prepare themselves to handle them?
So, in the early stages of motherhood, there can be certain challenges. It can be a little overwhelming for the new moms of how to deal with these challenges. So, we can understand the challenges in two parts. There can be challenges in breastfeeding from the mother's perspective. There can be challenges in breastfeeding from the infant perspective. So, let's talk about the mother's perspective first. The most common challenge that I have experienced during dealing with mother baby diet is positions and latching techniques. New moms, they are unable to sit comfortably, they are unable to spend time with the baby properly because of the lack of sleep, tiredness, their own postpartum discomforts. So positions and latching becomes an important step in the early stages, and it is the root of breastfeeding. So to deal with positions and latching becomes a very important challenge for a new mother, and the presence of a lactation consultant or a skilled lactation professional can help them guide which position is would be comfortable for them. There are varieties, there are different positions in which a mother and baby can breastfeed, and every position is not same for a mother. So if one position works for someone else, a different position may work. So your lactation consultant can guide you how and which position will be comfortable for you and baby, especially in the early stages. So that's one important challenge that you can face after you've delivered, the positions and latching part. Next part comes is establishing a milk supply. In the early stages, first 3 days after your delivery, you are not having enough amount of milk supply. Once you start breastfeeding your baby frequently, the rule of breastfeeding is the more baby removes milk from the breast, more milk will be formed. It is demand equals to supply. So the more you breastfeed your baby often, every 2 hourly is recommended, more your body is going to produce milk. So that becomes a challenge. If you are not able to position your baby properly, if you are not latching baby frequently onto the breast, baby is not able to remove milk out from the breast frequently. So you would face certain issues with the milk supply. The next challenge comes is certain hormonal issues, diabetic issues, thyroidism issues, PCOD issues. In these issues also, it is observed that the milk supply, it takes time for the mother to establish a good milk supply, especially in the early stages. The next challenge that you should be aware of about is your breast and nipple tissue related challenge. Means there are variety of different shapes and sizes of the breast tissues and nipples. Nipples can be inverted, nipples can be flat, nipples can be pseudo inverted, or nipples can be normal, protractile, normal shaped nipples. So, going back to my first point where I mentioned about the importance of breast examination or getting a breastfeeding class in your antenatal period, that's where you find out if you're having a flat nipple or inverted nipple, and then your lactation consultant can guide you what position or what techniques can help you. So, again, that can be a challenge. So there are different ways of dealing with breast and nipple related challenges. Different positions can be tried. There are nipple shields available. There are alternate feeding methods available. If baby is not able to directly breastfeed, we can try breast milk expression. Like again, we learned in the previous point, antenatal milk expression. We can try breast milk expression after the baby has been delivered. So breast milk can be expressed, breast milk can be stored and can be given it to the baby via alternate feeding method just while we are taking time to establish the direct breastfeeding. So these are the main common challenges which we have observed from the mother's perspective. If we go ahead and take on with the infant perspective, what challenges can be faced from the baby end? If a baby is a preterm baby, so preterm babies, they take a little while to establish breastfeeding, to understand how to latch onto the breast, how to accept the breast in the mouth, how to suckle, how to drink properly, swallow properly from the breast. So that's a challenge. A preterm baby can be a challenge. If a baby and mother is separated, like if a baby is kept in the NICU for observation for any other reason other than prematurity, even that becomes a challenge from the infant perspective. The baby is separated from the mother, so baby may take some time to understand how breastfeeding works for the child. There can be a challenge if there are twin babies, if there are triplet babies. There can be a challenge if baby is jaundiced in the early stages. If there are some oral abnormalities in baby, if baby is having some tongue related issue or cleft palate, palate related, mouth related issues. So these are the challenges from the infant perspective. So there are certain infant challenges. They take a time. They take a little bit more time from the baby end to establish breastfeeding. Again, we can try different positions and latching methods if a baby is not comfortable feeding in one position. We can try expressing the milk out. We can try alternate feeding method. Lots of skin to skin contact and bonding with the baby if a baby is separated from the mother. So these things you need to be aware of, that these can be the common challenges. And in breastfeeding, always remember, as time goes, mother and baby, they both get comfortable with it, because this is an activity like any other activity. Like we learn driving, you cannot learn driving and be perfect just on the day when you start driving. You have to give time, you have to be patient, there has to be perseverance and determination towards learning the activity of driving. Same thing works for breastfeeding. You have to be patient, you have to stay calm, you have to be relaxed, learn the techniques of learn the techniques and strategies of what is going to work for you, what is going to work for baby. And slowly over the period of time, you and baby are going to get on with it, you and baby are going to get into a rhythm, and that makes your breastfeeding journey easier. So that's what I want to take on with this point.
Taking cue from the last point that you said, that breastfeeding is a process, it's a beautiful experience, but it is a time consuming thing, and one will stumble, one will learn. So one most important thing during this process is that if there is a wrong posture, it can affect the feed, and it can affect the mother's body, the neck pain, back pain, all these issues start. So would you help the mothers with the right postures or some of the breastfeeding techniques?
Yes. So what I want to say is, postpartum in itself is a huge change for your body. Your body is dealing with a lot of things. Your body is now trying to go back into the pre-pregnancy state. Your muscles can be stiff. Your uterus is still lax, which requires contraction. Your breasts are preparing milk. Your breasts feel heavy. There can be neck discomforts. There can be leg swelling. So you need to address these concerns by choosing proper posture, choosing comfortable posture during breastfeeding. Because breastfeeding is an activity which you're not going to do just once a day. It's going to be happening frequently, so frequently, like every 2 hours, baby would ask for a feed, baby would demand, and you will have to cater to baby's needs. You will have to put baby onto the breast so that baby can get the optimal amount of nutrition required. So all those things are going to take a toll on your body. So choosing comfortable postures and choosing comfortable positions becomes crucial part for you in the early stages of motherhood so that you can recover soon, so that you can avoid any other extended discomforts which would come from improper positioning or improper breastfeeding techniques. So what I'm going to explain you here is there are 2, 3 comfortable positions which you can choose for your breastfeeding, especially in your early days. So I would like to demo a few techniques. You need to be firstly seated comfortable on a chair or bed so that your back remains supported on the chair rest. You can put a pillow, vertically aligned pillow, so that your back gets good support. Preferably choose a chair with the armrest so that your arms are supported, right? Elbows are supported. Your elbows also require support. Otherwise, you would feel fatigue in your shoulders and hands is carrying the baby constantly. Recommended to use a pillow underside of your hand so that you have a good support. Your hand needs a good support. First position I'm going to explain is the cradle hold. This is a traditional hold. It is a common hold. You may have seen your moms, your grandmoms explaining you this technique of hold the baby in your hand and latch baby towards you, take baby towards you. So the first and most important step to remember for the positioning is your baby needs to be completely turned toward you. Your baby's tummy needs to touch your tummy. Your baby's chest needs to come to you. If you are positioning your baby far away from you and baby's head is only turned towards you and baby is trying to latch onto the breast, that won't be possible for a child to latch. It will be very difficult for a baby to latch onto the breast, take the breast tissue and out and drink the breast. Baby needs to be facing you. Baby needs to be facing the breast. So this your while whichever position you take, cradle hold or the further techniques that we are going to see. First rule is your baby needs to be turned towards you, tummy to tummy. Second rule is a baby needs to be aligned in a diagonal way, not in a horizontal way. A diagonal way means the head should be above than the legs. You can see how I have placed the baby in a diagonal manner. So that baby's chin is lifted up against you, against the breast. Once the baby's chin is lifted up, automatically the nose goes behind and baby won't suffocate, because this is also one common query of mothers. If I bring my baby too close to the breast, baby's nose will block, baby will choke, baby will not get space for breathing. That is why it is important that when baby is closer to you, baby's head is tilted back and baby's chin is touched onto the breast. So in this position, baby needs to be turned towards you with the head extended, chin towards you. And then with your other hand, with your other free hand, you need to support your breast, like I mentioned, in a C shape. You need to support your breast fully in a C shape, or you can take a scissor grip and support your breast by 2 fingers. Make sure that your 2 fingers are away from the nipple. If you're keeping the fingers just onto the nipple, you're not giving enough breast tissue in the mouth. Your baby would latch then only on the nipple and would give you nipple cracks, nipple pain, bleeding nipples. So you need to give nipple and the surrounding areola inside the baby's mouth. That's why you need to keep your fingers away from the dark area. You can take a V-shaped scissor grip or a C-shaped manner. And in this way, then you're supposed to latch the baby. Always point the nipple towards baby's upper lip. Whenever baby is hungry, baby would give you a hunger signal like opening mouth wide. As baby opens mouth wide, bring baby towards you. Do not bend towards the baby. This is something that I have noticed frequently. Mothers, the new moms, they don't know the technique, so they are bending towards the baby, and which leads to back pain and neck pain. And also, baby is not able to latch properly. So you need to sit back, relax. You need to bring baby towards you so that baby can latch deep well and you're comfortable. So this part is important. This is how your cradle position is going to help you be more comfortable and easily breastfeed your baby. Next position I'm going to explain is called as a cross cradle technique or a modified cradle technique. You will be using your opposite hand to support baby. Again, your pillow will be down to support your baby on your hand. If you are using the left side of the breast, Your right hand is going to support baby's neck. Again, if you notice, baby is still towards me. Baby needs to be tummy to tummy with mom, stick towards mom, so that there is a good enough heat transfer. Baby also doesn't feel cold. Baby also has good thermal regulation. Baby feels close and bonded with you when there is good skin to skin contact. So baby needs to be again tucked towards you, tummy to tummy. With your other hand, same thing, C shape or a V shape. Like this, you're going to hold your breast. Point the nipple towards baby's upper lip. When baby opens mouth, you bring the baby to you. Do not bend in this way. Do not bend. Bring baby towards you. Whenever baby opens mouth, bring baby towards you. This will help you for a easier, comfortable latch and would prevent you from unnecessary back pain and back discomforts.
So the third position which I would like to explain here is also a very comfortable position. It is called as a football hold. Especially on your second day of your delivery, if you're having cesarean section, if there are discomfort related to stitches, you can use this football position and it will be very comfortable for you and baby. So for this position, again, our rule is baby needs to be touched to you, baby needs to be completely turned towards you. So baby is placed underside of your arm, under your arm. Baby's legs are towards the wall behind and baby is supported with a pillow. Baby and your hand are supported with a pillow. You have to support baby's neck from behind. Again, so much so that baby's chin is extended. The head is tilted back so that baby's nose doesn't block against the breast. Your breast hold would remain same, the C-shaped hold or a V-shape or a scissor grip. If you're using a C-shaped hold, again, you have to lift your breast up so that your nipple points at baby's upper lip. As baby opens mouth, you have to bring baby towards you. Even in this technique, avoid going towards the baby and latching. This would hurt your back. You would feel really discomforted. So bring baby towards you. When baby opens mouth, a wide mouth, as baby is hungry, baby would open a wide mouth, give you a signal that baby is ready to feed. Bring baby towards you so that baby can latch well and deep onto your breast and drink. So this is a really comfortable position, especially in your early days if you are not comfortable in taking baby in a position which discomforts your stitches, which presses on your abdomen or presses on your stitches. So you can take a note of this position. Also, this position is going ahead. If there are twin babies, you can use a double football position when your babies grow old. Babies are 1-2 months old. You can choose a nice pillow, a C-shaped breastfeeding pillow. You can hold both your babies together and latch your babies. So this is a really comfortable position, and I would like to highlight this position, especially in the early days for motherhood. More comfort and easier breastfeeding.
Coming to our next question, any suggestions or any tips to improve the quantity and quality of the milk?
All right, yes. So answering this question in two parts, talking about quantity and quality separately. How you're going to increase quantity of your breast milk, that is how you're going to increase your breast milk, is following the golden rule of breastfeeding, demand and supply. Put baby onto the breast frequently, every 2 hourly, latch your baby properly so that baby is able to effectively remove milk from the breast, giving your breast and your brain a signal to prepare more milk. So that's how you're going to increase your quantity of breast milk, by putting baby onto the breast. There are certain galactogogues available which help you to increase your milk production, like fenugreek seeds, fennel seeds, cumin seeds, asparagus or shatavari. Moringa is a herb. These herbs, they help you to increase your breast milk supply. They, not even using the word helping, they augment it, but you have to follow the golden rule of putting your baby onto the breast. If you are only relying on the galactogogues and not breastfeeding your baby effectively, then it is really not going to boost up your supply. So that's your mainstay of increasing the supply. Increasing the quantity of breast milk is putting your baby onto the breast, showing your body a signal your baby requires this much amount of milk the baby will produce. So demand equal to supply. You have to understand this rule. Talking about how to increase the quality of breast milk, you need to have good enough nutrition, good calories, especially when you are lactating and when you're pregnant. So pregnancy and lactation are in itself nutritionally demanding phases of your life. So your body requires good nutrition. just like your meals are planned and you're having good calories in your pregnancy, you need to continue having good calories even in your lactation period. You are going to be preparing milk for your baby. Breast milk is a whole nutrition for a baby. It includes carbohydrates, proteins, fats, waters, minerals, different kind of vitamins, everything all together. It's a complete nutrition for your baby. So from where your body is taking up these nutrition? The body is getting this nutrition from your body stores and the amount of food you're eating, the quality of food you're eating. That's why you need to have good calories, have a healthy, well-balanced diet rich in proteins. You can include veg and non-veg, both options in your protein diet. Good carbohydrates, include dal, rice, milk and milk products, include legumes, pulses, nuts. These are rich source of fatty acids, healthy fatty acids for you and your baby. Include lots of fruits and vegetables, fresh fruits, citrus fruits. All these things, they provide good nutrition for your body so that your body can make good quality of breast milk with good calories, so that those calories are received by the baby and it helps baby in good optimal nutrition. Again, keep in mind your diet does not determine your milk supply, because we have seen this myth. Many mothers are having this myth in their mind. They're asking the question whether the diet influences my supply. So diet does not influence your supply. The diet will help you to increase the good quality of your breast milk. Your supply or the quantity is based solely on your demand and supply formula. That means putting baby onto the breast, more milk removal makes more milk. To increase your quality of breast milk, you need to have good healthy nutrition. You can take small 5 meals throughout your day, have 4 to 5 liters of water, consume fresh fruits, nuts, milk products, include veg, non-veg, both as per your dietary preferences, get good rest, and spend time with your baby. So the more you're calm, relaxed, comfortable, having a healthy diet, it will definitely influence towards a good quality and quantity of the breast milk.
And talking about our last question, any sum up tips or any final piece of advice to ensure successful breastfeeding?
Lastly, just I would like to give some final thoughts about related to the tips for successful breastfeeding is consider breastfeeding as an activity which you and baby both are learning. So no one can expect you to be perfect in the early stages. No one can expect a newborn baby to be perfect in the early stages in terms of breastfeeding. So understand the strategies, learn the techniques, and go ahead smoothly. Be calm, be relaxed whenever you're spending time with baby in terms of breastfeeding, positions, and latching. It is very important that after your delivery, soon as baby is born, you put baby onto the breast. You can give your birth plan to your gynecologist and your pediatrician that you would like to breastfeed in the first hour of birth as recommended by the World Health Organization and UNICEF. And soon after the baby started breastfeeding, try to latch baby on frequently, every 2 hourly onto the breast. Get good understanding of the positions and latching, what positions, what techniques are working for you and baby. That would in turn help us to increase milk supply. Have good dietary habits, take good meals like we discussed in the earlier points, and relax, spend time with baby, cuddle your baby, hold your baby often. So that cuddling phase, holding and the bonding phase with baby makes you happy, makes your happy hormones to release in a good manner. That helps to increase the milk production.
Thank you, Dr. Jani, for that enlightening session. If there are any further questions or any misconception that needs to be clarified, please feel free to share the same in the comments. And I'm sure Dr. Jani will help us with her guidance. If you want to connect personally with Dr. Jani for any personal consultation, we will be sharing the details in the end of the video. So do check it out. If you find this video helpful, of course, do not forget to subscribe GenX Parenting right away. And do not forget to share this video with fellow mommies and support them to embark successfully on this journey. Thank you so much and happy Mother's Day once again to all of you. Thank you, Dr. Jani.